Hello, my name is Dr. Marcia Braden. In this video, I will be talking about behavior in Fragile X syndrome. Behavior is a very important aspect of those individuals with Fragile X syndrome. I probably get more calls about behavior and behavioral excesses than anything else related to these individuals. So what I've learned about Fragile X and behavior can sort of be summed up in this slide. The individuals with Fragile X syndrome show or tell us what they need, and it's really our job and our responsibility to help them communicate that need in a more productive and appropriate way. So they may act out because something is going on in their system. Their sensory system may be disturbed and dysregulated, or something may have embarrassed them, or something may have hurt them, and they're unable to articulate exactly what's going on. They will show us in their behavior. And so once again, we want to pay attention to their behavior in order to figure out what's going on. It's really a great diagnostic tool to use when we're building more adaptive behavioral patterns. If we look at their behavior, there is clearly a function that we want to determine. In other words, a reason for their behavior. These individuals are not people that want to misbehave. They don't want to be bad. They don't want to hurt other people. It's their neurological condition that really causes them to overreact to certain stimuli. So again, we want to observe the behavior and look for the function so that we can modify the behavior. Those behavioral excesses are not intentional, and most of the time it is in response to their neurobiology. So they may show you that they need deep pressure to calm themselves down. And so in the first picture we see an individual who very much sleeps and loves sleeping in between cushions. And we could look at that as a very odd and inappropriate behavior, which it is from the outside. So when we really look at the function of why they're sleeping between the cushions, we can determine that they need the deep pressure, that they need the co-contraction to their joints in order for them to relax. So to make it more functional, we can use a vest, as this teacher is doing on the right side of the slide. We can use deep pressure and squeezes to give them the same input so that then they can relax and go on learning. The behavioral cycle is a very interesting one to analyze. If you look at this slide, you're going to see that there are a number of things that are conditions and part of the syndrome. We know that there are gross and fine motor delays. We know that there's a great deal of anxiety, that there's difficulty waiting or sitting for long periods of time without high interest materials. And if we continue to present something to these individuals that cause them to wait or to attend to something that's not interesting, we oftentimes will have a behavioral excess. We also know that sensory dysfunction is a difficult area for them, and we know that if, in fact, there is a lot going on in the environment that will pull on the environment and also overwhelm their sensory functioning, we will see behavioral outbursts. We know they have language delays and cognitive delays. And so if we put them in a position where they have to respond verbally, or they have to understand or process something in a way that's difficult for them, they may in fact use behavior as a way to escape those expectations. So what's the behavior that they're going to exhibit? They may run away, they may flop on the floor, they may destroy something that you're trying to teach them with, they may hit, they may scream, because you're pushing on that weakness, that area of weakness that's going to cause them to become very angry or aggressive. So then they engage in the inappropriate behavior, and we need to respond to that behavior. Parents, teachers, therapists, oftentimes we respond in an inappropriate way. So if they've pulled our hair, it's really hard to continue to be neutral. But I'm asking that you try that because it really does set the stage for future behavioral episodes. They will expect the same behavioral feedback and response from us that we gave them the time before. And that sets in motion this behavioral cycle. In other words, once the behavior starts, it has to complete the cycle to finish out. They will depend on you and will habituate the response pattern from a teacher or a therapist. And that has the potential to maintain that behavior. If, on the other hand, we respond in a different way, that response pattern has the potential to reduce that behavior. What are the foundations of behavior? It's really important to attend to this because in order to change a behavior, we have to understand sort of the foundation and how it starts, what it sits on. We know that all behavior in any human being serves a purpose. We also know that behaviors do not continue unless they're reinforced in a way that's viable and really very helpful to those individuals who sit on the other side. We know that behaviors do not continue unless they're reinforced. And oftentimes we don't even know when we're reinforcing a certain behavior. Sometimes the reinforcing aspect of the behavior is internal. And so again, it may be something that when they're flapping their hands and then when they're doing certain things, that's an internal sort of reinforcing aspect. If we don't address the cause of the behavior or the function of the behavior, then we will not be able to change that behavior. That is a critical element in this process. We often do functional behavior assessments for that very reason. It gets us close to understanding what that foundation is, what that cause, and what that function is. We know that all behavior serves a purpose. Often, we see it as a way to get our attention. And so we see little ones that are typically developing, getting our attention by tugging at us or doing something naughty. People with Fragile X syndrome have that same tendency to get our attention in that way. They also want access to certain activities. And so if we take something away that's high strength, that they enjoy, they're going to behave in a way to sort of get our attention and gain access to that activity that we took away. So they try to get our attention and gain access to that activity that we took away. We also know that many times they try to escape or avoid. This is a classic with individuals with Fragile X syndrome. And oftentimes, it's as simple as engaging us in a conversation. We know that they're very social. They're very socially engaging, and oftentimes have learned, and we've reinforced, the fact that if they begin talking to us, we may in fact not demand as much or ask them to complete an assignment or a task. Some behaviors are more difficult to extinguish because they're internally motivating. This individual is biting his hand, and we see this so often in people with Fragile X syndrome. And it comes with distress at times or even excitement. But what we know is happening is that that individual is gaining co-contraction of his joints and pressure to his mouth and to his head. And again, if we look at that particular behavior and really look at the function, we can help him learn ways in which he can stop biting his hand, but maybe do a chair push-up or push against us, or help us determine a way that we can push against his joints to relieve the anxiety and the frustration that he's experiencing. We often conduct a functional behavior assessment, and through that we can determine the ABCs of the behavior. The antecedent is the first thing that we look at. That's the action that occurs directly before the behavior. This is often very hard to determine, Because when we look at behavior and when we're doing our assessment, we oftentimes focus more on the behavior than anything else. In other words, it gets our attention. But if we're doing a functional behavioral assessment, we've been very careful to note the time of day that we're in the classroom or we're at home observing the behavior. And we take note of those things that seem not related to the behavior, or things that really are not getting our attention, but rather we're chronicling what's going on in that observation. And as we do this properly, we will determine what's going on before the behavior because we've noted it in our chart. And then when the behavior happens, we can describe that behavior and we can operationalize that behavior. In other words, we won't just say that he's getting angry. We need to say he's hitting, or he's kicking, or he's pulling at our hair. We need to define the behavior very specifically. And then we continue to note and observe what happens after the behavior has occurred. Because what happens after the behavior is as important as the behavior itself. So, looking at the ABCs of the behavior, we're going to be very careful to look at the antecedent. And as we go back over our notes of observation, we may see that there was something that happened at 8 a.m. in the classroom, and the child with Fragile X seemed to do quite well. He went through his day, and at 10 o'clock, he had a behavioral episode. We can't determine what the antecedent is because at 9:30, everything was fine. There was nothing going on that was different. There was no change in the routine. There was no noise. There was no sensory input. There was nothing going on. And so if we go back to the 8 o'clock time period and we see that there was a change in the behavior, this person with Fragile X syndrome may in fact accumulate a behavioral response to that antecedent. So it's very important to take good note and to recognize there are a number of things that can happen earlier in the day or earlier at home that can in fact trigger a behavior. And then we will look at what happens after the behavior. Again, it may not be an immediate consequence. It may be something that happens a little later after the child calms down. But this is the motivator. This is the motivator to the behavior. This is what either changes or helps continue the behavior. And again, very important to note the consequence as well. So let's talk about determining those antecedents. Sometimes they're pretty difficult to find or define. If we're doing our analysis and taking our notes of observations, then we want to be very careful about what we see happening. Those antecedents could be as simple as some change in the routine or schedule. There could be a new person on board, a new person in our life that has come into the environment that the person with Fragile X has enjoyed, but suddenly is there in a different capacity. That new person who was a friend is now working with this person at home and helping that person with activities of daily living. That could really trigger a response pattern because oftentimes these individuals, because of their global learning, put people into a certain area, put people into a certain environment, and when those people are taken out of that environment, it creates some discomfort. We often hear teachers say that when they see their student at the grocery store, again, out of the context of their environment at school, the child with Fragile X overreacts and may even have a meltdown. And basically that's because that individual doesn't fit in that framework for them. We often think it's pretty difficult to determine where to start when we're looking at these antecedents. And so again, we have to look back at a good observation chart. We have to take good notes, and we can definitely find those antecedents. Sometimes we create additional issues because we're trying to make things better. And so again, when things start to trigger a behavior, we want to be very careful that whatever our intervention strategy is, it does not maintain the behavior. It does not make this child any more anxious because we're delivering too much input. And then, when we make the change in a systematic way, we often will be able to decrease the need for any other interventions. In other words, we're sort of figuring out a puzzle here. We're figuring out what the cause of the behavior is, meaning the antecedent, and we're figuring out what the consequence is as a result of that behavior. And when we do that, we can get lined up a nice sequence of interventions that will work in a systematic way to support that individual. If we're really good at determining antecedents and we adjust for those antecedents and we do some reducing of whatever is coming into that sensory system or what's causing that behavior, then we wouldn't have the behavior as a consequence. In other words, if we change the antecedent, if we modify the antecedent, the behavior will not follow, and our work becomes very easy in the long term. We do have to remember that even though we look at the antecedent as sort of the cause to trigger the challenging behavior, oftentimes it's the consequence. So again, flipping that model and putting the C before the A is important to take a look at. If we have a young man who acts out, and then the consequence is staying in the classroom to have his lunch, he's avoiding the loud lunchroom, he's avoiding some of the smells in the lunchroom, and he's being really reinforced with the consequence. In other words, he gets to stay in the classroom, and he has a lot of attention from the teacher because he acts out right before he goes to lunch. So he's telling us, it's too much for me to be in the lunchroom. It's too much for me to be down with all those children and all the loud noises. And so I'm going to act out so that you'll keep me here. What we want to do with that data is we want to turn that around and help him express verbally what's really going on and ask for a break or ask for a place to eat that's farther away from the group. Maybe he wears noise-canceling headsets to lunch, and that is a way that he can prepare for that environment. The potential triggers for challenging behavior are pretty direct, and I would suggest that you go through these when you're looking at your antecedents or your triggers for behavior. And if you remember to control for these, the chances are good that you're not going to have episodes of behavior in your classroom or at home or in the workforce. So we know that if you work too long with an individual with direct instruction, that there's going to be some problems. And they're going to engage in behaviors that get them out of that working situation or a way to escape that sort of work. And we know that if the material's pretty boring, it's low interest, it's not loaded visually, or they have to repeat over and over again using mass trials, chances are good that they're going to engage in a behavior that allows them to escape that low interest instruction. If we don't prepare them for changes or transitions, we can almost depend on the fact that they're going to have a meltdown. They're going to engage in a behavior that lets us know, again, communicates to us that they are uncomfortable, they're anxious, they don't understand this transition. If we don't load things visually, they won't understand what we want. They will not learn as well, and they'll become more frustrated and maybe even embarrassed, which will trigger a challenging behavior. If we don't allow them to move and express the break so they have a choice of when they're ready to take a break, then again, oftentimes it will result in a challenging behavior. If there are a lot of distractors in the classroom and they're trying really hard to attend to the task but not getting it done, they will let you know that it's too noisy, there's too many distractors, people are talking, whatever's going on. And again, we can redirect that to a way of verbalizing that and allowing them to move away from the distractors. We also know that if we overreact, if we become very upset and our intonation patterns change, our language changes, and we're not neutral, there is going to be a problem in terms of that reaction to whatever is going on. The individual with Fragile X is going to respond to that in a negative way and probably engage in the challenging behavior. Oftentimes, these individuals over-respond, meaning that if we're too animated or we're too silly or we're touching too much or we're hugging too much, that's going to be overwhelming to them. And it's going to get their arousal system elevated to the extent where they are going to be challenged. And they may engage in hand flapping, hand biting, or some of those sorts of behaviors that we know are a result of them being overstimulated and hyper-aroused. So what accommodations can we bring forward to help modify the behavior and truly support the behavior? We want to allow for the individual differences. This is not a cookie-cutter sort of lecture. I've given you lots of ideas about what may, in fact, result in behavioral challenges and meltdowns, but each individual is different, and we do know that there are differences in this population that we really need to attend to. There may be an individual who learns very well and can even handle phonics, as has been able to learn in a traditional system, but he's very hypersensitive to any sensory input. And so again, smell or noises or those kinds of things in the environment may really set them up for a problem with their behavior. We know that some of these individuals need more sensory breaks than others, and we know that they show this by the way they behave. We also understand that a quiet space, access to headphones and visual supports is very important in accommodating and modifying behavior. If you give a task to them, that oftentimes can aid in a transition. So again, those simple accommodations can help modify behavior. If in fact an individual is leading their group to the gym, it might be better to give them something to do. These people with Fragile X syndrome love to help. They love to have a special job or an assignment. And so again, it may work for them to carry something in a bag or in some sort of a box that could be the equipment for the PE class. And in that process will allow them not only to help, but they will get some feedback to their co-contraction of their joints and give them some heavy work, is what we call it, as they transition to the gym. You need to allow for a consistent routine and also reinforce finishing the task. When you do this, you will cut down and reduce the triggers for any kind of a behavior. We oftentimes use a token board to summon attention, so when the board comes out, individuals with Fragile X understand that they are going to engage in an important task of learning. It also allows them to see how many answers they need to give or what their response pattern will be, and the task will end when the tokens are all earned. Teach flexibility to them in a systematic way. Even though we advocate for routine and we know that that is something that helps them with their behavior, we want to make sure that we also introduce some flexibility because life changes, routines change, and in order for us to provide really good teaching and systematic parenting, we need to allow them to learn the flexibility. We also need to give them forced choices. And in learning flexibility, we can give them one of two choices, either one being okay with us, that works in the environment or works in the system. So in other words, if we feel that they're getting sort of habituated to a certain routine or a certain way of doing something, we might switch it up by saying, we can go to PE or we can read a book. So again, both those choices are fine, they're okay, but it enables them to be a little more flexible with a schedule or a routine rather than always following it consistently and in the same way. So in summary, it's important to remember that all behavior serves a purpose, that these individuals do not intend to hurt people, do not intend to destroy things, do not intend to misbehave. As a matter of fact, they often, at the end of an episode or a meltdown, will cry and tell you how sorry they are. The function, really, of their behavior is to deal with their neurobiology, and that becomes very debilitating for them. So oftentimes, the only way that they can deal with that neurobiology is to misbehave in a way that they escape. Individuals with Fragile X syndrome observe and understand all the reactions that we give them to their behavior. And by this I mean we need to be very mindful of the response pattern that we exhibit to individuals when they are misbehaving or when they are having a behavioral excess, because they will take in every bit of what we're giving them. If we neutralize, if we respond in a systematic way, if we know what we're doing and it's all been planned out in a protocol, they will respond accordingly. If we are frenetic with our approach, if we're angry, if our voice and intonation changes, they will also respond to that. And all that will do is to multiply the anxiety inside of them. People with Fragile X want to behave. They want to gain our acceptance, and they love a positive interaction. So try to remember that as you go through this process of behavior modification, as you look at behavior function, as you look at ways that you can help these individuals improve their behavior and be more accepted.